Hi there, my name's Dr. David Russ. I'm a chiropractor. I practice in Portland, Oregon. I've treated hundreds and hundreds of people with disc injuries, some of them quite severe. I myself have dealt with this twice. If you've clicked on this video, you are either dealing with this or someone you love and care for is dealing with this. You're scared, maybe. You're looking for answers for sure. I hope to be able to provide some answers in a grounded way, reassure you that this will get better, even though it's hard to believe sometimes. And I just want to kind of explain what's going on and what can be done about it. So this is part 1 of 3. Part 1, what is happening? Let's talk about this injury, why it hurts so much, why it's so scary, how it happens. Part 2, we'll talk about the way forward. How does this heal? And then part 3 will be rehabilitation. How do we strengthen and how do we make it so that this isn't going to happen again? Because this is scary. We don't ever want to deal with this again. So let's just start with some basics. You have a herniated disc. You are not alone. Many people deal with herniated discs in the course of their life. It's mostly people over 35. That 35 to 45 is sort of a sweet spot. People are starting to age, but not really yet understanding the limitations of their age, not really being able to do the things they used to be able to do without hurting. I know for a lot of people, they wind up in this situation where they're flat on their back with a herniated disc in their back or their neck, and this is pain that they've been feeling for a while. They've always just sort of been able to ignore pain. Things generally get better on their own. After you hit 35, for many people, not everyone, it's not like that anymore. So this happens to lots and lots of people. Again, it happened to me. It happens all the time. It can be really super painful. Potentially one of the most painful things that happens to human beings is a herniated disc in the neck or the lower back. And also, it's really scary. And I'm here to tell you that fear and that panic and that sense that like, this is the end, I will never be better again, that's part of it. That happens to almost everyone. That emotional component, that emotional overlay is part of the pain. It's not true. You will get better. This will heal. You have to help it heal, you have to let it heal, and I want to help you get there, but it will heal. Let's make sense of what's going on, okay? So you have probably seen this diagram of the spine from the back and from the side, and then this one over here on the right is showing one of the vertebrae comes out. It's got the disc on it, and that's looking at the disc from above. And of course, this vertebra would have a disc below it as well. So every disc has a vertebra above and a vertebra below. And let's look at the structure of this disc. It's a bit like a jelly donut. This outer part is fibrous, it's very tough, and the inner part is gelatinous and squishy. And we have names for these. This disc acts as a shock absorber because the outer ring is called the annulus fibrosus. Sometimes we just say annulus. And this center, the squishy gel part, is called the nucleus pulposus, or mostly just called the nucleus. And the way that this acts as a shock absorber is that when you compress the disc by putting weight on it, the squishy part squishes outward, pushes into the annulus, which holds it in. And so it creates a mechanism for transforming a compressive force into an outward force that is then held together by the annulus. But what happens is that over time, the annulus will start to get injured. And we can see in this diagram, this annulus has some fissures here where the layers of fibers have started to come apart a little bit. That weakens the structure of the disc. And down here in the lower right, it's called the posterolateral, which is usually where the injuries take place. There have been either enough of these micro injuries that have coalesced into a large tear, or sometimes a traumatic injury, a fall, a car accident, or something really, a big major injury will cause the annulus to tear all at once. And then the nucleus leaks through, and that's problematic. The nucleus leaks through and it pushes right here on this nerve. And if you look at this diagram, here are the two vertebrae with the disc in between, and the compression just from the weight of the body is causing the nucleus to squish, which is what it's supposed to do, but the annulus isn't there to hold it in, so it squishes out, and here it's pressing on the nerve. And in the diagram, it shows the nerve being red because that is really painful and irritating, And I want to show you, a lot of times when you look at these pictures, it really looks like there's a lot of space, like this is a great big canal and this little tiny nerve. Isn't there room for the nerve? Well, no, not really. This is a much better drawing of showing what's in there. This space is full of fat and ligaments and blood vessels and other nerves and lymphatic vessels. It's packed pretty tightly in there. There's not a lot of room. So interestingly, and this is of a great import to you because it impacts your healing in the future, the body can actually adapt to a little bit of pressure on the nerve without any pain or problem. The nerve can find a way through this canal, even if there's some intrusion by a herniated nucleus pulposus. A big part of the issue is the swelling, and we'll talk about that more. So this hurts a lot. The pressure on the nerve hurts a great deal. And if this is you, you are experiencing layers of pain. So let's talk about the layers of pain that you're in and explain to you why it feels the way that it feels, okay? First of all, you have disc pain. So the injury to the disc, the tearing of the annulus, the leaking of the nucleus, that's painful. Just like any torn tissue, any torn ligament, an ankle sprain, a shoulder sprain, a neck sprain, a whiplash is going to be pain in the site of the injury. And this is an achy, stiff, tight pain. The disc in the lumbar spine will refer pain, in other words, send painful sensation into the buttock, around the tailbone, sometimes into the thigh, sometimes into the front, into the groin, or even into the genitals. If it's in the neck, then it will send pain down into the shoulder blade usually, sometimes into the upper chest. So that's your disc pain. Then we have another layer of pain, which is the nerve pain. So the nerve is being compressed. The nerve is being irritated because there's a lot of inflammation happening. The inflammation comes in to heal the disc injury, but that inflammation brings with it chemicals that are extremely irritating to the nerve. So the nerve pain is not only mechanical pressure, but also chemical irritation from the inflammation that's going on. And this is what is killing you. This is that sharp, hot pain that you cannot ignore. It hurts so bad. It is always front of mind. You cannot tune it out. It doesn't get better with activity. It doesn't get better with rest. It's just always, always awful. And then on top of all of that, your muscles are working really hard trying to support and stabilize and splint and guard this. And just like any overused muscle, it will start to hurt. It will develop trigger points. It will develop knots. It will get sore. It will get achy. It will feel tired and it will feel weak. So this is your 3-layer cake of painful misery that is really, really difficult to deal with. And if you're in this situation or you love and care for someone who is, my heart goes out to you, but it will get better. We're going to show you how, okay? All right, just a quick word about me and my channel. I've got a lot of content on my channel for folks with lower back pain, for rehabilitation, for core stabilization, and information about all kinds of body pain, as well as demonstrations and videos of what treatment should look like for you. And I'll put links to relevant videos to this subject in the video description. And I really do hope that you watch and like and subscribe and maybe even become a channel member and support what I'm doing. So why is this so scary? There is a neurological, anatomical reason why this feels the way that it does, and I'm going to show this to you right now. Okay, so this is that picture like we saw before of the disc from above. There's the nucleus here, there's the annulus, and what this yellow stuff is, this yellow gold, that's nerve tissue. Okay, so here's the spinal cord, and here's the root of the spinal nerve coming out here. Here is where it's going to get compressed, right here. That's the entrapment site from a herniated disc, that posterolateral herniated disc. Well, up here, that little bump, that's called a ganglion, and that is a bundle of nerve cells. And whenever nerve cells bundle together, it's because they're coordinating something. And in this case, these cells coordinate your fight or flight response. It is directly attached. It is a direct branch of the nerve that is being compressed by the disc. So when the nerve is being compressed by the disc, you're feeling all this pain going down your leg or going down your arm. At the same time, there is a very strong emotional response because your fight or flight system is being activated and you don't know why. There's no immediate threat that you can see. This is a type of pain that carries with it inherently, intrinsically, a very strong emotional component that is alarm, panic. And if you feel that long enough, usually it only takes a couple of weeks, and sometimes people can be in disc pain for months and months, that will start to morph into despair. And people just give up because they're like, I will never be normal again. But I'm going to tell you again, you will be normal. So the number one thing we need to focus on in this acute stage that you're in is the swelling and inflammation. Swelling and inflammation is creating a tremendous amount of physical pressure in this tight space, and that is creating a lot of pain. That fluid pressure is stretching tissues that don't like to be stretched. It is crowding tissues that don't like to be crowded. It's also irritating the nerve. Remember, that nerve does not like to be bathed in inflammatory fluid. It's angry. And so if you can get the swelling down, you're going to have more movement, you're going to have less pain, and you're going to have less irritation of the nerve, which means more physical and more mental and emotional comfort. So in the next video, part 2, coming up very soon, we're going to talk about how do we get that swelling down, how do we get ourselves out of this acute stage and into a place where we can be reasonably comfortable, have some predictability day to day while this thing heals, and how long does it take to heal, and what do we need to do to get that done. So just some things for you to take away. Yes, this is awful and it's horrible, but you're not alone. This happens to a lot of people. I see dozens of them every year. Almost nobody needs surgery. It's like 90% heal on their own. I would say maybe 75% heal without any sort of aggressive intervention, such as a cortisone injection, although that is there for you if you need that. This will get better. The panic is part of it. That will also get better. I'm here. I would like to help you. In the next part, the path forward. We're going to talk about how to get that swelling down, how to rest and avoid re-injury, because, spoiler alert, what makes this so bad and last for so long and months is people keep re-injuring it over and over because either they don't know what to do or they're getting bad advice. You need to get some good hands-on work. Okay, obviously that's something I love to do, and if you're in Portland or near Portland and you need some work, I will gladly do that with you. You're going to re-strengthen gradually, and you're going to have reasonable expectations for timelines and things you can do in the meantime. And then we're going to do part 3 of this video series, which is how do we get back to normal, which is specific ideas, direction, and resources for core stabilization, avoiding re-injury, sensing your body, softening, re-educating your nervous system out of this fight or flight and into normal movement again, and also preparing you for occasional aches and pains. Because once a disc is injured, it's normal, typical, for folks to have little problems here and there. Not the thing that dominates your life. We don't want that to ever happen again, but a little stiffness or a little aching here and there is not out of the ordinary, and it's not the end of the world. Okay, so this has been Dr. Russ. This is part 1. What is happening? I'm talking about disc injuries. Remember, thank you for watching. I always appreciate it. Questions, comments, and there'll be some video links in the video description. I hope you feel better real soon. Dr. Russ out.